Hi, my name is Nina Brewer. For this module, I would like to talk about or go more into depth about healthcare and how color codes are used within the healthcare system. In my last video, I went into depth about why color codes were important, the value they hold in hospitals and different clinics, and also what kind of effects does it have on the hospital itself or the environment and the people and the staff as well. So after reading my article that I found online, which is called Breaking the Code by Kurt Harris, he goes a bit into depth about why color code is important and, as said before, the value of color codes, but he also digs deeper into it by providing us data. And with that data, he shows us that a lot of nurses within the healthcare system see that color codes and having an emergency code or warning system is very helpful and actually does give peace to the people who are working in the hospitals and provides peace to the family and the friends that are there to see their loved ones. This is the same for clinics as well. As I said in my previous video, working in the healthcare system, it allows me to see firsthand on how a color code is effective and what kind of effect it has on the environment, what kind of environmental changes it has, and the effects it has on not only the staff, family, and friends, but also the patients themselves. And I really do think color codes are important, and it's a valuable part of having in a hospital or a clinic. Um, Kurt Harris also speaks about the training that goes into color coding and how a lot of the nurses state that training for emergency warnings, whether it's a color code or not. In this case, it is a color code, but how helpful it is for them and how the lack of confusion is very beneficial because the training is so in depth. To be on the floor and to be a staff member, you have to know the color codes because you need to be aware when a code is being called, what the code is for, and who is and is not supposed to know about the code. It's very important that the targeted audience hears about the code. Kurt Harris states that 62% of nurses have relayed that color codes and knowing emergency warnings or codes have been very helpful for them, not only creating a safer environment, but also making relaying messages easier amongst each other. Color coding is also very important, if you ask me, because it is a visual and an audible warning. A color code can be called over intercom as well as sent through tablets, watches, phones, any kind of device. The color can be sent and seen by people or by the people who it needs to be seen by. Um, Thank you guys for watching.